And interestingly, when we look at our study, at the Global Drug Survey, we see that people with challenging experience not necessarily consider them as bad trips because they learn something and it still helps them to reflect on their lives and can be a lesson learned.
Yeah, I heard that many times, that even a bad trip is still a very profound experience that could teach you or reveal something really profound about your past that you might have suppressed and never had to deal with. So I definitely agree that there's just so much potential in it. So I know a friend of mine, she lost someone really important in her life, and she went to Peru to mourn because she lost any hope or meaning in life. And she was able to really feel what he felt and really connect as to why he did what he did and let go. And I'm really interested about how does that affect us, and are there maybe studies that could help us really turn something around. I've read some studies and books about how in the past there were clinical researchers who actually facilitated the treatment of mental health issues such as depression, anxiety, PTSD. And for me, this is such an important topic. I think that anyone, and like if there's any one chance that this actually can help, this is so worth talking about, and this is so worth exploring. So I wonder what other studies that you are aware of that are undergo or that are important to you that you wanted to bring people to the awareness of them.
Yeah, I mean, currently there are many studies conducted compared to earlier in Europe and also in America. And these studies are not relatively new. They were also already done in the 50s and 60s. But what is new that everything is really controlled, that you get IRB approval, you have ethical approval for these studies, and the barriers to conduct such a study are super high. Nevertheless, first findings in phase 1 and phase 2 trials using, for example, LSD or psilocybin to treat social anxiety of terminally ill patients, a study in Switzerland by Peter Gasser, or also even treat substance use disorders with these kind of substances from the point of view that you can actually maybe erase the memory in the brain or actually rewire the brain to know that the addiction is going away. So these are huge things, and it sounds really exciting.
That's fascinating.
It's fascinating, but it's all small-scale studies and some people who have profited, and nevertheless we need to see what the phase 3 trials bring and whether these medicines can actually really become, or these currently illegal drugs can actually really become medicines.
Yeah, and in California we actually had, or are having in about a month or so, the election ballot where you can vote to include some of the psychedelic use in the medical usage to treat any kind of mental health disorders. So I'm really hoping that something will come out of this. What are your views on this?
Yeah, I mean, it's super exciting that this was brought to vote, and I think it's important. For all the studies that are currently conducted, it's also important to mention that there are inclusion and exclusion criteria. So, for example, people with a bipolar disorder or people with a psychosis will probably not benefit, and it's just the risk is too high and safety by administering drugs with a psychedelic effect is not guaranteed. So these studies cannot be conducted, but for certain other things like depression or anxiety that cannot be treated otherwise, or chronic upcoming repeating disorders, it can be really helpful for some of the people. And also at UCSF there is currently a study conducted, the first group therapy study where actually psychedelics are administered for treating this demoralization and really severe depression. It's a study by Josh Woolley and Brian Anderson that I just met today, and the first initial findings of the ongoing study are promising because people really improve in these symptoms and they could actually help, but at least there are people already improving before the intervention actually happens. So it's not just administering a drug, but it's also having these integration sessions before and also after the studies. And the good thing is, compared to other drugs and antidepressants and stuff that you actually take for months and years, these kind of treatments or the drug is actually only administered like on 1 day or on 3 days within a 12-week or 3-month treatment or whatever the time frame is. But it's just really few sessions that are facilitated by actually using these drugs.
By the psychedelics.
Yes.
So only a few sessions are needed compared to months and years of having antidepressants like SSRIs. And that's huge because that means that we can treat someone just within a few days and not need any, well, potentially.
Yeah, would be nice.
Yeah, would be really nice. But instead of keeping them on drugs ongoingly and keep prescribing people something every time, which is really powerful.
Yeah, I mean, most of the surrounding narrative or rationale about these studies is built on that people in today's society cannot really cope with losses, or they don't have the room, or with other things like being gay or having AIDS or other STIs. This can be related to a lot of shame, so people don't talk about it. And by not talking about things that happen in your life, including sexual assault or rape, anyone can be traumatized by these experiences, and by just putting it down and going on as if nothing would happen, that can actually create these mental health symptoms that can then be maybe better coped with when bringing them back to memory, but in a state of mind where you can actually work through them.
Yeah.
And help.
I hope that more research is actually in support of that, and I know that we really need to shift the mindset about the drug and how we approach it and what role it plays in our society. And if we start looking at it from something scary that you need to distance yourself, I think there's a lot to learn about compassion and acceptance and even the role of the drug itself. And it's not something just to escape, it could be something that helps us deal with our problems and unresolved issues that we just suppress, as you said. So this is really powerful.
Yeah, I think we can go from there and looking at altruism as something to achieve for everyone. And at the same time, when we look at drugs, we want to have more honest conversation about both the risks and the benefits of drugs.
Right.
We want to learn more about the drugs, and the barriers that we currently have, especially with research, is research funding on one side. These studies are not really getting funded, or it's not in line with research priorities of the national institutions. And the other thing is the legal status. Everyone would like to have more evidence showing that some treatments, or even including psychedelic assisted psychotherapy, are helpful or not. And let's prove us wrong. Let's prove the whole science that is upcoming wrong. But to prove it wrong, we need more research, right? And this is not really easy to do. So what I'm hoping for the future is really that the barriers are getting lowered, that more young researchers get empowered, and that more studies can be conducted that look at samples and drug use realities in different kind of ways. And this is what should shift drug policy, and not ideologism.
Yes, absolutely. And the acceptance to conduct these research methods. I know that there is a lot of resistance from all kinds of governance and levels of bureaucracy to fight through to get the permit. And so it's definitely something that you have a mission.
It's all about reducing the stigma around people who use drugs, knowing and acknowledging that the vast majority of people who use drugs recreationally are doing relatively well with some health risks, mainly due to the unknown content and purity of the substances. But this is something we could actually regulate as a government or as a society. And going from there to the next point, where we can say that drug use is something that people were always interested in, and something that will not just disappear, especially not with the regulation and legalization of cannabis in several states now. So people want to experience more, they want to explore more, but they may also want to live healthy lives. And that's where research comes in, where we can actually find a balance of health education and pleasure to actually teach people also that, for example, safer use or more moderate use can be more pleasurable drug use.